Hi, San Ildefonso. Good morning. It's Tana from Bridge to Health, New Mexico, over here at the Espanola Fitness Studio at 628 Riverside Drive. We have a sign now so you can know where to come and visit us. We're so proud of our sign. Hope you guys are having a wonderful day. It's September 29th, Wednesday, and I'm going to give you a half an hour presentation today. If you jump on, we can interact, which would be awesome. If you don't, leave your comments and questions on YouTube when you see this posted. I'm going to give you a half an hour conversation today about how our culture influences our health. This is one of my favorite topics. Actually, it's what I went to school to study, is cross-cultural health communications. So I love this topic. I want to say from the get-go that half an hour is definitely not enough to do this topic justice. But Madhu, who you're getting to know now, will do an hour-long presentation on it. Not this Saturday, or whenever she does it, not this week, but next week. All right, so it's our last time together in September. We will see you guys in October, and let's get started with this presentation. Give me a moment to share my screen and get your notebooks ready, get your questions ready. All right. Here we go. How culture influences health beliefs and therefore health outcomes. So we all come from so many different cultures. So the important first thing is to define culture. Oh, are we playing? No, almost. All right, there we go. How culture influences health beliefs. First of all, what is culture? Culture is defined as the patterns of ideas, customs, and behaviors shared by a particular people or society. These patterns identify members as part of a group and distinguish members from other groups by language, religion and spiritual beliefs, gender, socioeconomic class, age, sexual orientation, geographic origin, group history, education, upbringing, and life experience. You can see by that definition that we all have overlapping and separate cultures within ourselves. So for me, I might say I am a Caucasian female. That defines two of my cultures. But I'm also in a Muslim family. That defines a culture. I also am a parent. That's part of my culture. I also have higher education. That's a certain culture. So we all have multiple cultures happening within us. Very important to remember that culture is dynamic and evolving. It's learned and passed on through generations. It's not something that's genetically coded into us. It's something that we learn. Culture is something that's shared among those who agree on the way that they name and understand reality. Culture is often identified symbolically through language, dress, music, and behavior. It's integrated into all aspects of our life. Now, there's a line that you can't see on this slide, I'm sorry, but it's a very important line. So let me stress it now. It says, generalizing specific characteristics of one culture can be helpful, but be very careful not to overgeneralize. So when we're talking about culture, we're not talking about creating bias or stereotypes of individuals. What we're talking about is a large group of people who share patterns of ideas, customs, and behaviors. But you should never use information about cultural patterns to assume you know how an individual is going to act or why they are acting that way. What I mean by that, we can say that females in general have a certain pattern of being in the world. But you should never assume that because somebody is female, she's going to have that pattern. It gets a little tricky there. That's why we really need a whole day workshop thinking about culture. But I do want you to keep that in mind as we go through that the information we're talking about today is generalizing, may feel like stereotyping, but is not stereotyping because we're not talking about a specific individual's behavior. That's complicated. We'll talk about that more later. Let me know your thoughts on that in your comments. Okay, there are many ways that we can break down general patterns of people of different cultures. The first way we're going to talk about today is collectivistic versus individualistic cultures. And again, we're going to bring this all around to the effect of being either culturistic or individualistic on you and your health and the health of your family and community. So first of all, what is a collectivistic culture? There's a focus on we, us. The group is very important. There's a focus on promoting relatedness and interdependence. In a collectivistic culture, I am nothing without you. What I do only matters in how it affects you. We need each other to survive. In a collectivistic culture, there's a very strong connection to the family. There's value on respect and obedience. In a collectivistic culture, we emphasize group goals, cooperation, and harmony. What's important is the success of the group. What's important is the fact that the group is happy at the end. What's important is the fact that the group felt like they got along in accomplishing whatever they're accomplishing. And finally, in a collectivistic culture, there's greater, broader influence of group values and views. Conversely, in an individualistic culture, there's much more of a focus on I, the individual. There's a large value placed on autonomy or the ability to do something on your own, to make decisions on my own, to do what I want to do. In an individualistic culture, there's a view of ability to make personal individual choices as a right. It's my right to do what I want to do. I don't have to worry so much about the group or the family. It's about me. In individualistic cultures, there's an emphasis on individual initiative and achievement. What have I achieved in my life? Even if my family hasn't achieved a lot, what's important is what I have achieved. And finally, in an individualistic culture, there's a lesser influence of group views and values and in fewer aspects of life. So individualistic people who are part of an individualistic culture, they're still influenced by the group, but not as much and in not as many different areas of their life. I do want to point out at this point that there is no judgment of better or worse when we talk about anthropological variations in culture. It's just showing differences in the culture. So we all might have a knee-jerk reaction of seeing our culture laid out and assume it's better than the other culture. So I want you to be aware of those feelings as we go through this talk. That will help you know which culture you belong to, the one that you automatically think is more positive or better. You will probably realize that's the culture that you come from. So I'm going to ask you to leave judgment at the door and really, really be open just to realizing that other cultures have different patterns, and it's so interesting. Give me just a sec here to get myself some water so that I can talk clearly. I hope you're helping yourself. to water during this. Okay, moving on. The next way we're going to break down cultures is in two broad patterns of communication styles. And those are high context and low context communication cultures. So when we talk about communication, just like the picture here shows, we're talking about how people talk and how they understand each other. So high and low context cultures is a concept borrowed from the world of anthropology to explain differences in communication among members of different cultural groups. Don't forget, we're going to bring this all back around to your health. High context culture and low context culture are ends of a continuum of how explicit the messages exchanged in a culture are and how important the context is in communication. So I'm going to break this down for you. In a high context culture, indirect and implicit messages are very, very important. That means I might not tell you explicitly what I want you to understand, but I expect that you're going to take cues from the context around our conversation to help understand. In a low context culture, what you say is what you mean. Direct, simple, and clear messages. In a high context culture, they have a tendency to be polychronic. We're going to talk about time and perceptions of time. Polychronic means I can do many things at the same time. Low context cultures tend to be monochronic, more likely to do one thing at a time. We're going to explain a lot more about that in the next slide, so I'm not going to go into that too much. High context cultures have a high use of nonverbal communication. That would be facial expressions, tone, use of the hands, use of nonverbal ways to communicate. In low context cultures, there's a high reliance on written communication because written communication is very direct, simple, and clear. This is what I'm talking about, the words I wrote. In high context cultures, there's a low reliance. Oh, excuse me, I did that wrong. In low context cultures, there's a low use of nonverbal communication. The words I say are what I mean, no matter what expression is on my face or what tone of voice I'm using, how I'm using my hands, it's about the words. High context cultures, low reliance on written communication. There's not very much written down. In low context cultures, it's a high reliance on written communication. High context cultures use intuition and feelings to make decisions. Low context cultures rely on facts and evidence for decisions. High context cultures place high value on long-term relationships. This makes sense if you look at what we've already talked about high context cultures, is that it's easier to read the nonverbal cues of somebody who you know very well. So it's very important to have those long-term relationships. In low context cultures, more value is placed on short-term relationships. Again, that doesn't mean that in low context cultures, they don't value their long-term relationships. They're just not as important to communication. That's because if I am able to write down exactly what I need you to understand, or I'm able to use words, direct, simple, and clear messages to help you understand what I am trying to get you to understand, we don't really need to have had a long-term relationship. In high context cultures, relationships are more important than schedules. Read that again. My relationship with the people around me are more important than the schedule or the time in a high context culture. In low context cultures, this is flipped. Schedules are more important than relationships. We're going to talk a little bit more about that later too when we talk about time. In a high context culture, there's a strong distinction between the in-group and the out-group. It means either you're somebody who I have a long-term relationship with and therefore will spend time on, or you're not in my group and that's more important. In low context cultures, relationships and friendships seems to be more flexible and open. Again, this is about communication. High context and low context cultures are about communication styles. I hope you see yourself somewhere there. Just a reminder that most of us who are functioning in places like New Mexico are quite adept at functioning within both high context and low context cultures. If you're a professional, if you're working in a place like northern New Mexico, you're probably really, really good at doing both of these. So I want you to remember that we have the culture that we're born into, the culture that we are raised in, and the cultures that we learn to function in as professional adults. So high and low context cultures, very interesting when it comes to communication style. Moving on. Oh, this is a big one. When we talked about polychromism and monochronism in high and low text cultural communication, we need to break that out a little bit. There are huge cultural differences in perceptions of time. Chronism has to do with time. So chromatic, the Latin root chrono always means time. Mono always means one. So monochronism is one time. Okay, monochronistic cultures believe in doing one thing at a time. So you might find that in your culture, it's more acceptable to sit and do a task, finish that task, and then move on to the next task. That's monochronistic. In monochronistic cultures, time is tangible and valuable. Time is something that is counted on a clock, and 1 minute past is 1 minute I could have been doing something. Schedules are very important in monochronistic cultures. If you're part of a monochronistic culture, you might feel very comfortable scheduling out your day at the beginning of the day. Time itself is treated as a commodity of high value, as necessary, or perhaps even more important than satisfaction, good work, and relationships. Time is more important than feeling good, than doing good work, or of relationships. Time is stressful to people in a monochronistic culture. You primarily find monochronistic cultures in North American and Northern European cultures. In these cultures, time is viewed as linear. That's like, I'm at this time now, and in 5 minutes, I can no longer go back to this time. It's linear. It continues moving and you can't go back to it. In these cultures, events are scheduled one at a time, with one event following another. Nothing happens at the same time. Schedule may take precedence over interpersonal relationships. We already talked about that. If you are part of this culture or comfortable in a monochronistic culture, you may be having lunch with your mother, but you know it has to end at 12:15, and so it ends at 12:15, even if she still wants you to stay. There's an emphasis on schedules, punctuality, and preciseness. In monochronistic cultures, being on time is very important, like exactly on time, or maybe a little bit early, but never late. In monochronistic cultures, we emphasize doing things, using our time wisely, because we view time as something that can be lost, killed, or wasted, or conversely, as something that can and should be managed, planned, and used efficiently. Monochronistic culture. Now moving on to, whoa, what did I do? I passed my slide. Okay. Polychromism. Let me take a sip while this loads. Polychromism, again, going back to our Latin roots, poly means many. Chronism means time. So in these cultures, several events can happen simultaneously. Several events can happen at the same time. Interpersonal relationships are highly valued. They're valued more than time. Time is less tangible. Time is not viewed as something that you can grab onto and hold onto. There's an emphasis on the involvement of people and the completion of transactions rather than on schedules. So in a polychronistic culture, there's a lot more emphasis on who's involved and how those people are getting along rather than getting something done on time. Multitasking is valued. In these cultures, you can do many things at one time and do them well. You see this culture more in Latin America, African cultures, Arab cultures, and Native American cultures, just as a few examples. There's a perception of time considered to be more connected to natural rhythms, to the earth, and to the seasons. We view time as being more flexible, not so linear. It could be circular, it could be curvy. It's more flexible. In polychronistic cultures, scheduling and being precise is seen as simply not that important. Relationships with people are valued more than staying on schedule, and more value is placed on being than doing. More value is placed on how you are feeling, how you are, who you are, than on getting something done. Polychronistic culture. Okay, moving on to the point of this talk, how culture impacts our health. I want you to take a moment to look at that image. It's called the Cultural Iceberg. On the top are things we see: age, gender, possibly gender, right? That's now been shown to also be on a curriculum. I almost said a curriculum, a continuum. You can see appearance, you can hear language, you can see clothes. But things we don't see about people that are related to culture are under the water, and that's what we're talking about today. How culture impacts our health. Culture frames and shapes how we perceive the world and our experiences. Bringing it back to health, how patients and their healthcare providers, their doctors, their nurses, view health and illness will be different depending on their culture, different or the same. What patients and healthcare providers believe about the causes of disease are very affected by culture. So you can imagine if you have a healthcare provider from a polychronistic culture and using high context communication, and you have a patient from using low context communication and coming from a monochronistic culture, you might find that the healthcare provider is late for the visit, and that is highly offensive to the patient. You can see where that can cause problems. Going back to the belief about causes of disease, some cultures believe that disease is caused by a higher power and there's not much that we can do about it, while other cultures believe that disease is caused by things that we have control over, like bacteria, virus, or behavior. Culture can dictate which diseases or conditions are stigmatized and why. Is depression stigmatized in your culture? Why is that? Is it because you come from a culture that is collective and therefore your health condition says something about your family? Or is it individualistic, where your health behavior has to do with you individually? Culture impacts what types of health promotion activities are practiced, recommended, or insured. How illness and pain are experienced and expressed. Where patients seek help, how they ask for help, and perhaps when they make their first approach towards help. Culture affects patient interaction with their healthcare providers a lot. Culture impacts the degree of understanding and compliance with treatment options that are recommended by healthcare providers who do not share their cultural beliefs. And finally, how patients and providers perceive chronic disease and various treatment options. All of these things are affected by our culture, and you can see how this would impact your interactions with healthcare providers in the medical system. Culture also affects our acceptance of a diagnosis, including who should be told, when they should be told, and how they should be told. It affects our acceptance of preventative or health promotion measures, such as vaccines, prenatal care, birth control, screening tests, etc. This is something that we see for tons of topics in our everyday work and healthcare, but everybody is seeing the effect of culture now around vaccines for COVID-19, around masking for COVID-19. All of those reactions are somehow based in culture. Culture affects our perception of the amount of control individuals have in preventing and controlling disease. Culture affects our perceptions of death, dying, and who should be involved. Culture affects our use of direct versus indirect communication. Making or avoiding eye contact can be viewed as rude or polite, depending on culture. Our willingness to discuss our symptoms even with a healthcare provider or with an interpreter being present. Although the gender or the perceived gender of our healthcare provider, depending on our culture, can make a difference about what we tell that healthcare provider. Culture affects the influence of our family dynamics, including traditional gender roles, legal responsibilities, and patterns of support among family members. Culture affects our perceptions of youth and aging and how accessible the health system is, as well as how it functions. These all have to do with our culture. Before I come back to seeing you in person, I want to suggest that you take these fun culture quizzes just to help you figure out what culture you come from. Maybe you think that you're very clear on the culture that you come from, but you might discover that you have multiple cultures that are happening within you, and it's kind of fun to figure that out. If you don't know where your cultural bent is, apart from your race or what your parents told you, take one of these quizzes. The question is, am I from a high or low context communication culture? The next one is a fun quiz about world cultures. The next one, fun quiz about how much you know about cultural taboos. And the last one, which world culture do I fit into? So it asks you a bunch of questions, and then it says, oh, you would fit in very well in Greece, or in America, or in Brazil. So that's kind of fun. I really want to encourage you to do those by taking the URLs here. I believe when Madu does it, she might take you through some of those quizzes. That would be kind of fun. All right, give me a moment to stop sharing my screen and come back and see you in person. All right, hi guys. That's a very big and huge topic. And I want you to think of it as the beginning of a larger conversation, a larger recognition in you and in all of us for how culture affects our health beliefs about disease, about healthcare providers, about medicine, how it affects our behavior, what we believe certain behaviors are going to help us or not in our health, how it affects our families and our communities. With no judgment, I just want us to be aware so that we can look for opportunities to improve our health within the cultures that we belong to. Huge topic, guys. Can't wait till Madhu does the whole hour on it. And this is always something I've kind of had fantasy about doing a workshop on here at Bridge to Health. So maybe we'll put that together and you'll come and share your thoughts and your experiences in your culture and your health. You guys have a wonderful, beautiful, fabulous day, and we will see you later. Bye-bye.